So you've come to this video because you're wondering how to get pregnant after coming off of birth control. Well, we have got an exclusive video just for you with Dr. Boyd, our board-certified OBGYN with 26 plus years of experience, helping many women get pregnant, helping them through their pregnancy, labor, and delivery. Before we get started on this video, click the link below to download our 3-step guide to getting pregnant. Also, we would love for you to visit Pearently.com and be prepared in your pregnancy with our online course, Pearently Foundations. So let's jump into this video.
This is a great subject for women because it's so exciting when you think and plan on getting pregnant. But women ask all the time, am I that candidate? Am I that person that's not going to get pregnant? And I assure you that it's a small risk. 90% of you are going to get pregnant. 90%. So keep that in mind. Now, it may not happen for you yesterday, because when women decide they want to get pregnant, it is yesterday. So the thought of waiting X amount of months to get pregnant is hard for a lot of women. Plan on it taking a year. That 1 year is important to understand in your time frame for getting pregnant. Today we're going to talk to Savannah. She's got a list of questions that I've asked her to prepare. And so, Savannah, go ahead and ask your questions.
Okay, so I've been off the birth control pill for 3 months, and I'm still not pregnant. So is that something that I should be concerned about?
The answer is no. So all women that are on the birth control pill should plan on taking up to 6 months to get pregnant or to self-regulate. Now, self-regulation is the most important understanding here. What do I mean by self-regulation? That means your periods have returned to normal. What is normal? Usually you can look at your period history before you went on the birth control pill to know if your periods were normal. And that would be something that would concern you if you were never normal, and you should see your healthcare provider before that 1 year period of time that we talked about. But in answer to your question, 3 months, no, you should not worry about if your periods have returned to normal at this point.
Okay, so you mentioned my cycle. So what do you mean by a normal cycle?
Okay, so a normal cycle is normal, all right? Now, I understand that's kind of a funny term, but normal is defined as the beginning of one cycle to the beginning of the next cycle, and you follow that pattern from month to month to month to month. Now, so if in your past history, before you went on the birth control pill, most women know how often their periods occur. So a period is defined as the first day that you see a spot of blood, and that is called day one. So you go from day one of one cycle to day one of your next cycle when you see a spot of blood. In that period of time, you need to look from month to month to month. So what is normal? 21 days up to 35 days. So anywhere in that period of time is defined as normal. Now, if you're 21 one month, 35 the next, 28 the next, 21 the next, that's still within that period of time, but it makes it more difficult to assess when you're ovulating. Okay? So self-regulation often depends on what your cycles were before you went on the birth control pill.
Okay, and so for me, can I expect to see consistency from one cycle to the next if I am regular? Like, will it be like 21 days and then 28 days, or will it be 21 each month? Okay,
so most women follow a pattern that is in the period of time that they were before. Okay. So if you were 21 days before, you usually are 21 days after you come off the pill, okay, and 21 days after the next month, the next month, the next month. Okay. But it can vary. So it can be 21 to 24, 21 to 25, but it's usually around that same period of time. So again, if you had 28-day cycles, 26 to 30 would be considered normal. If you had 35-day cycles, it would be 31 to 37 approximately. Not every woman follows that exact same rule, but again, it's a time period specificity where you usually are following the same period of time.
Okay. So now, you mentioned self-regulating. Can I self-regulate my cycle myself?
No, you cannot. Now, there is an exception to that. Let's assume that you were very, very large and overweight, okay? And so you had a significant weight loss. Oftentimes women that lose large amounts of weight can self-regulate. But for the average person, and I look at you and you're not overweight, typically you're going to self-regulate just based on the normal physiology of your body. So you're a miracle. The human body is a miracle. And you start the process of regulating your menstrual cycle in your brain. And your brain tells another part of your brain that tells your ovaries to ovulate, and that prepares your uterus for an impending pregnancy.
Okay.
And so that's what you mean by self-regulating. Now, we see it clinically in the form of a menstrual cycle. So if you're going to self-regulate, that typically means that your menstrual cycles are going to be normal, as we defined a little bit ago. Now, does that mean you're ovulating if your menstrual cycles are normal? Universally, the answer is yes. Women that have normal menstrual cycles typically ovulate within that same period of time. Now, there's other things that you can look at. So, ovulation typically occurs in the mid portion of your cycle, and we'll just address that right now. So, and we're going to use a 28-day cycle to give you this example. So if you have a 28-day cycle, again, that means from the beginning of one cycle to the beginning of the next cycle, that's 28-day period, or 28 days in that cycle. Typically you ovulate 14 days before the start of your next cycle. So in a 28-day cycle, you would ovulate around day 14. Now, that's an exact science that we don't know of. So rarely do women ovulate exactly 14 days before their next cycle would be. Now, I say would be because if you get pregnant, obviously you're not going to have your next cycle. So what time period can you identify when you are ovulating? Well, again, 14 days, the perfect, but you take 7 days away from that, that goes down to day 7, add 7 days to that 14 days, and that's 21 days. So your ovulatory period is from day 7 to day 21 on this 28-day example. And so you have to get together with your spouse and say, okay, honey, we're going to have intercourse every 48 hours, starting on day 7, all the way through day 21, okay? And if you follow that period of time, universally within that 1 year period of time, you will get pregnant.
All right, so I want to interrupt this little chit chat here with Dr. Boyd and his patient and remind you to click the link below to download our 3-step guide to getting pregnant and visit Pearently.com to take a look at our Pearently Foundations online course that is going to help you be confident and equipped in your pregnancy, labor, and delivery.
So you mentioned ovulation. So what are some other signs of ovulation?
Okay, so ovulation is a mechanism where you are releasing an egg from the ovary. So for fertilization to occur, you have to have a sperm and the egg get together. And so there's things that you can identify as a woman whether you are ovulating. Now, it's not exact, but there's things that clinically you can assess. First of all, does your husband look better than he looked last month, 3 days before your period? In other words, are you feeling the affection toward him where you're leading and he's leading so that you have intercourse? That's a great clinical sign that you're potentially going to ovulate. The second is, does my vaginal discharge look like it's becoming snotty? Now, that's kind of a gross term, but if you have increased snot-looking discharge, you are potentially ovulating. So those two factors in and of themselves are two of the best factors to identify clinically whether you're ovulating or not. Now, women ask me all the time, well, what about checking my temperature? Checking your temperature is such a difficult task for most women because you have to check your temperature 1 hour before you wake up. Now, what do I mean by that? Well, you go all night long. You cannot get out of bed for a minimum of 4 hours before you check your temperature, because when you get up out of bed, your temperature goes up. So when you're identifying whether my temperature goes up for ovulation and you've been out of bed in the last 4 hours, it's going to be artificially elevated. And you say, oh my word, I'm ovulating today, but it was simply you got out of bed.
Okay.
So you've got to check your temperature, minimum of not being out of bed for 4 hours. So when you wake up in the morning, your thermostat has to be right over on your, or your thermometer has to be right over in your nightstand. You have to lean over, put it in your mouth, and you have to do that at the same time every day. Well, it's a task that creates so much anxiety for women. I do not encourage women to do that. Now, another test that actually works pretty well is an ovulation predictor kit. If you want to spend the money, it's a great form of identifying whether you're potentially ovulating. And it's a lot like checking a urine pregnancy test. It's looking for hormones in your body that signal that maybe you're ovulating. So you start checking your urine around the time of ovulation. So in this example we're giving, in a 14-day, you're ovulating on day 14. The ovulatory period is day 7 to day 21. But potentially that would mean that you're checking your ovulation predictor kit all the way from day 7 all the way to day 21. Well, there's not enough strips of identifying marker, and you may have to buy 2 or 3 or 4 ovulation predictor kits, which gets very expensive.
Okay.
So I usually don't encourage women to do that.
Okay. Okay. So then, what happens if I have been off the birth control for 6 months and I'm doing all those things that you mentioned? I'm having intercourse every 48 hours and I'm still not pregnant. Then what do I do?
Okay. So at that point, I still would not be concerned, because if you look at all women that are attempting to get pregnant, it can take up to a year. So you've been off the pill for 6 months. Mm-hmm. When did you become normal in your menstrual cycle history? When were your menstrual cycles normal?
So I think around month 3.
Okay. So that's technically the time clock start of when fertility can occur. So that's your start date for fertility. So in your example, my cycle's regulated. That typically means I'm ovulating, and I'm going to go out 12 months from that period of time. So we'll just give it. So let's say that you started having normal cycles in March of 2018. So if we go forward 12 months, that would mean all the way to March of 2019, when you potentially can get pregnant. So I would not be necessarily alarmed during that period of time. Now, that's assuming that you stay healthy, that you're not obese, that you don't have an enlargement in your neck indicating that maybe you have a thyroid problem, that you don't have other issues. Then I would wait for that 12 months. Now, as women get closer and closer to that 12 months, they start becoming anxious. Mm-hmm. And it wouldn't be a bad idea to notify your healthcare provider in your 9th month, hey, I'd like to make an appointment to see you in 3 months, so that if you're not pregnant by that 12-month mark, that you can see them and ask the appropriate questions and get your exam and have labs done appropriately.
So should I see my healthcare provider prior to being pregnant, or should I wait until I'm pregnant before I call him and make an appointment?
Okay, so that's a great question. It's first of all, it's never a bad idea to see your healthcare provider, because information is power. The more information that you have, I think you will feel better and have decreased anxiety. Now, I'll give you a couple scenarios where maybe you will see your healthcare provider before that 12-month period of time. So let's assume that you've been off the pill for 6 months and your cycles are not regulated. So at that point, it wouldn't be a bad idea to go in to see your healthcare provider, because he would do an exam on you. He would check your thyroid labs. Assuming that that is all normal, he would probably put you on a progesterone hormone, a hormone called progesterone that's released from your ovary that will oftentimes regulate your cycles. When you regulate your cycles, usually you will self-ovulate at that point. And so it's a very simple treatment that will decrease anxiety for many women. Assuming that your cycles are normal at 6 months and you don't have any other issues or previous issues in your past, I don't think you need to see your healthcare provider at that 6-month mark like you mentioned. However, it's very, very important that as you're in the process of getting pregnant, that you're on a prenatal vitamin every day. That prenatal vitamin has to have a minimum of 400 micrograms of folic acid, and you need to take that every day. Now, people ask about prenatal vitamins all the time. As long as it says prenatal vitamin on it, it has enough folic acid in it that you're protected. Your baby's protected against what's called a neural tube defect, like spina bifida. However, it's not a bad idea to also add more folic acid with your prenatal vitamin. So taking a prenatal vitamin every day and adding 1 milligram of folic acid every day will decrease your risk for your baby having a neural tube defect. And you can just buy both of those over the counter.
Over the counter, okay. So then, speaking of seeing my healthcare provider, do I need to have a pap smear before I get pregnant, or is that something that I should, again, wait until after I'm pregnant?
So again, in a healthy woman that has no past medical history, doesn't have a family history of issues, not concerned at all about having STDs, then it's okay to wait until you're pregnant before you see your healthcare provider. Now, again, it's not a bad thing to see your healthcare provider. And women ask me all the time, when should I have my first pap smear? Well, the guidelines have changed in the past several years. So you don't need to have a pap smear until you're at least 21 or sexually active in a situation where you're concerned about STDs. So if you're a newly married woman and you have no issues, at some point you'll need a pap smear. But again, it's safe to wait until you're pregnant to get that done.
Okay, so then is infertility very common? I know you've mentioned it a little bit, but is it a common thing that I should be concerned about?
So 90% of women that get pregnant have no problems getting pregnant within that 1 year period of time, okay? So if you look at across the board, you have a 90% chance for getting pregnant within a 12-month period of time if you have regular intercourse and you have no problems, okay? No medical history, no thyroid issues. Okay. 90%. So just imagine, if you had a 90% chance of winning the lottery ticket, would you go buy a lottery ticket?
Yeah.
And the answer is yes, almost everybody would. But what dwells on us is that little guy that sits on your shoulder and says, you won't get pregnant, you won't get pregnant, you won't get pregnant. It's nonsense. Less than 10%, 10% or less, have fertility issues. And that doesn't even mean infertility. Sometimes it's subfertility. In fact, it's most of the time subfertility. So the actual number of women that have true infertility, that means they cannot get pregnant without assistance, is a small percent. So it's important to understand. So in this subgroup of subfertility / infertility patients, it's not even the woman in the great majority of the cases. So if you look at subfertility or infertility, 40% of the time it's you as the woman, 40%. 40% of the time it's the man. And men are shocked to hear that, but it is actually them, the same percentage as it is for women. And then 20% of the time it's who you married. So if you marry John Doe, you may have no problems, but if you marry Jack Smith, you may have problems getting pregnant.
Okay.
So again, it's 40% female factor, 40% male factor, 20% on who you marry.
Okay, and even that is just 10% of the population.
10% is all that encompasses.
Okay.
90% have no problems.
Okay, so then what do I do? So what are some different treatments for infertility if I am infertile?
So the most important thing, I mentioned this, is a good clinical history and a good clinical exam. We can determine as healthcare providers if there's an issue, oftentimes just by asking the right and appropriate questions. So after we do a good history, do a good exam, and do laboratory work, majority of women that don't get pregnant is because of ovulatory issues. That means they don't ovulate on a regular basis. Mm-hmm. The perfect woman ovulates about 10 times per year, okay? That means she still misses 1 or 2 cycles per year. So that would mean that excluding that perfect woman, so to speak, that means other women ovulate all the way from 0 times per year up to 10 times per year. So that period of time means that you may not get pregnant on the month that you think you're going to get pregnant just because you didn't ovulate. So the most important thing is to help self-regulate. We mentioned that word earlier. And oftentimes we do that with a hormone called progesterone. And you just take it on a monthly basis, and that oftentimes will regulate your cycles. When you regulate your cycles, you typically ovulate. There's a drug called clomiphene or Clomid. It's been around a long time, and it's a fairly safe drug, and we can use clomiphene to help the ovulatory part. So clomiphene increases your chances for ovulating. It's taken 5 days in the early part of your cycle, and it's something that you would have a discussion with your healthcare provider. Now, that's the female part of it. The male part of it is if you have trouble getting pregnant, we're going to send your husband to a urologist to make sure that he doesn't have a sperm problem. So he's going to be examined by the urologist. They're going to do an exam on his body, I know most men can hardly stand that thought, but they're going to examine the man, and then they're going to do what's called a semen analysis on him to determine if he has a problem with semen production. Okay, and then assuming that those two pathways go down, nothing wrong with the woman, nothing wrong with the man. Eventually, you'll end up in an office of a infertility specialist. Okay, they're called reproductive endocrinologists. Those are the people that will talk to you about IVF or other forms of helping getting pregnant. Now, again, that's a tiny percentage of patients, and even though we've mentioned it, the great majority don't need to be concerned about that.
Okay. All right. Well, I think you've answered all of my questions. Thank you very much.
Okay. Have a great day.
Thank you.
All right, so that was our fertility talk on how to get pregnant after you come off the birth control pill specifically. Now, if you still have some questions, you're wondering how to calculate ovulation and your menstruation, click the link below to download our free 3-step guide to getting pregnant. Also, don't forget to visit Pearently.com and take a look at our online course, Pearently Foundations, that will give you everything that you need to know to be empowered, fully equipped, and confident in your pregnancy, labor, and delivery.